Hi, Chris from OrthoWell PT. Once again, there's another specialized service that we offer here at OrthoWell, being cupping therapy. Cupping therapy is typically something done in like traditional Chinese medicine facilities. Acupuncturists do it. Done a lot in Chinatown, for example. It's been around for a long time. They used to use like bone shards. They used to use like bone cups. When glass came, they ended up using like glass cups as well, which a lot of practitioners still use glass. We actually use the polymer gel cups here. So the procedure is essentially there's actually a couple different reasons why we use cupping. If you talk about it from an Eastern standpoint, it's to kind of draw chi to the area. So when we put the cups on, it actually creates a little pressure change that occurs in the cup that draws the tissues up into the cup. So a Chinese or an Asian practitioner would say we're kind of drawing energy to the area. We're drawing the body's chi or healing current to the area. It actually draws circulation in there as well, because after you cup, you can see like little red marks on the skin as well. So from a Western standpoint, we actually use cupping, at least in our clinic, from the standpoint of using cups in combination with motion. So we can use cups as a static treatment, where the cups are just on and they're just providing that lifting effect and that chi, elevating effect. Or you can put them on and then use motion in combination with the cups to enhance the stretching effect with the cups. So as you'll see, when I place the cups, I put a little bit of lotion on the skin just so it doesn't kind of dig into the skin. So, but of course, we don't get into the whole, acupuncture and the acupressure sort of meridian lines, like the energy lines in the body, but you can actually place the cups along the energy meridians throughout the body, and that's the same thing in that whole traditional Chinese medicine realm of things, that if you place these on a certain line, you can affect the gallbladder, you can affect the kidney, you can affect some other maybe organ system in the body. We're not doing that here, but when we place them, you still can get that effect of like the chi being released, and sometimes, like for her, I'll actually put one of the cups right on C7. C7 tends to be a part of the body in Chinese medicine where, say for example, cold enters the system or sickness enters the system. Okay, so but that's really, in Judy's case here, we'll pretty much hit that one spot here. We of course are elevating the tissues that attach to C7, but then we're hitting different spots throughout the system as well. So I'll put cups on the upper traps through here, and I'll push down and create the negative pressure, draws up the skin, and same thing on the opposite side. Push down here, create the negative pressure, and Matt, can you see that? Okay, see how that draws the skin right up into the cup here. To take it off, I'll just kind of slide my finger underneath the cup, and you can see even right now, Judy, you create a red mark very quickly, but then it dissipates because the circulation gets shunted away. And the research that's been done on cups says that even with the effects of the cupping afterwards, it's not really a bruise, it's not tissue trauma that occurs, it's just a circulatory response or a histamine response that brings the circulation into it and creates that redness. So it's not like it's been traumatized afterwards, and the redness can last anywhere from 2 days to upwards of a week. First time I had it done, it lasted for about 2 weeks. You can traditional Chinese medicine practitioners will judge the response of the cupping in terms of what kind of sickness is involved, or what kind of energy issue might be occurring in the system, and that's a little bit over and above what we do here. Okay, but put the cup on here. So as I said, there's a lot of different ways to look at this, but here in our clinic we kind of do it more from the Western standpoint of just putting a little bit more tension into the system to get a little bit more of a release of tissue as she's moving, which we'll show you in a second. So we're hitting the traps here, we're hitting the rhomboids here. I'll take, and like I said, I'll hit that C7 point. This is just based upon, I put it here based upon my readings and talking to my acupuncturist as well. So we get the effect at C7 right here. So we're pre-tensioning, and a little bit of a pattern here, and we do it different for all kinds of different conditions. Judy, last time we did the shoulder, we put a couple on her shoulder, had her move her shoulder up and down. Patients come for their back, you can put a couple on their back, and get them doing exercises where they bend forward or bend around, or you get on their hands and knees, for example, put the cups on their back, and they kind of go into child's pose, and stretch this way, stretch that way, to kind of mobilize that tissue. Okay, for Judy, we're going to have her essentially just, let's have you just bring your chin all the way down your chest and slowly move through it so you feel a bit of a pull, and then back up. Then let's have you look down and to the left the next time. Over there to kind of incorporate more of a combined motion, and then back up, and then down to the right. Okay, then back up. Now let's have you turn your head to the left, or if you can that way, then back forward, and to the right. Okay, and we'll have our patients go through like a little circuit. Maybe try 5 going down, 5 to the side, 5 to the other side, and then you incorporate even some bigger gross motor sorts of movements. Let's have you spread your knees apart a little bit for me, please, and then chin all the way down, and then let's have you reach down and have your arms. Maybe give yourself a hug. There you go. Give yourself a hug and really spread those arms out. There you go. And really try to open up the shoulder blades and really try to open up the rhomboids as we pre-stretch it with the cups. And then back up. And then back to your starting position. And then even take your arms and you grab them like there you go. Now we got a big stretch there. And then chin all the way down, then all the way down forward. And then hold for a second or two, and then back up. And keep on going there. So like I said, this is more dynamic cupping. You have the cups on her, and she moves. We create a release of tissues. We typically do this for 5 or 6 minutes to get a release, and we typically will follow our Graston work, our active release work with the cupping, and then have them run through their stretches, so say for her rotator cuff strengthening, her scapular stability, work through here, or to just go work on some core stuff. So that's pretty much it. That's cupping in a nutshell. Okay, thanks a lot. We'll see you.